Welcome to NMP Talk Show, the show that keeps you informed and engaged with topics about your mental health wellness. Today's show, we're talking to Sister Cathy Seakamela, a Director of Unjani Clinic in Kagiso and Motlhakeng. We've invited her to join us on the show today to speak about a very important topic that we're contending with, heart attacks. It's an inside battle that every one of us at one point of time will be fighting or is fighting. So I want to see how we can deal with these issues, and she's in a better position to help us deal with that issue. So, Sister Cathy, welcome to NMP Talk Show. How are you doing?
Thank you, Neo. Thank you for this opportunity you have given to me, and
There.
thank you, viewers. Yes.
Thank you so much. So, who is Sister Cathy Seakamela? Please tell us about you and tell us about. I see you also wearing your gear there from Unjani Clinic. Also, tell us about Unjani Clinic.
Okay. I'm the director of Unjani Clinic in Kagiso, and also Unjani Clinic, which is our new baby in Motlhakeng. So we have been in Kagiso for 6 years now. We are approaching 7 years. Unjani Clinic, basically, you will find it in all the 9 provinces. The clinics currently, we are about plus minus 170 clinics. Now, these are the clinics that are owned by nurses. And then our main aim is to provide quality health care to our communities. We are bridging the gap between people that are working, the working class, but they are unable to afford medical aids. So that's basically our target market, and also our elderly, especially those that find that they go to local clinics, and then with the long queues, you find that for them it's a tedious exercise. So we are providing affordable services. For example, it's 300 rand consultation and the medication. So they don't have to go to the pharmacy to get their medication. So we are basically providing holistic approach regarding the healthcare.
Oh, right, you still there? Oh yes, yeah. Something happened with the internet there. We didn't get the last part of it, but we got the most part of it, that you are everywhere and especially caters for the elderly, which is something very good. You know, okay. I'm getting a feedback. Sorry, you're not connected with another device, eh? Okay. All right. Sorry. I don't know where it was coming from. But otherwise, let's get into the meat of things. The reason for this show we're talking about heart attacks, and I want to welcome those that have just joined us on the show. Those that are connected on Telegram, thank you so much for joining us. What you're going to do there, if you have a question or any comment, you have a circle there in the middle with the man in the hand. Click on it, I'll unmute you, and then you click again to unmute yourself. Then you will be able to ask questions live on the show to our esteemed guest here, Sister Cathy Seakamela. And we also have those that are connected on this platform that we're streaming from, which is Riverside. You're also welcome there. But for you, you can type your question over there, and we'll be able to see on the chat, and then we'll read it out to our esteemed guest. Now we're getting over to the topic at hand. Sister Cathy, what is a heart attack and what's the cause of it?
Right. A heart attack is basically um, the heart that is pumping, But unfortunately, in this case, you find that there is no blood flow to various parts of the body. And this is caused by it can be a constriction, which is the there's no flow. Something is obstructing the blood vessels. I'll give an example with a hose pipe. When you connect a hose pipe, you want this hose pipe to go and garden your plants. So what happens when you have a heart attack? It means there is no blood flow to your garden, meaning that the heart is pumping, but now there's no flow of blood to various parts of the body. Now, how do we see that the person is having a heart attack? Right. A heart attack will see with the chest pain. And this chest pain, it's a sudden chest pain on the left side. And then it will also radiate to the left shoulder, the neck, going up to the extremes of the fingers. So it's just a sudden pain. Now, this pain can last for about 10 to 20 seconds, and then from there it just stops, right? So, when this happens, and then it comes very strange to your body. Therefore, we need to know our body, we need to know how our bodies react, because with a heart attack, we can get signs, we can get warnings. It can happen in the first episode, it can happen to the second episode.
How you explain it. For me, I thought a heart attack was maybe blood rushing back to the heart, and there's a large amount of blood going in there. Like you have this feeling of explosion that might erupt on your heart, but it's not something like that, eh?
No, it's not.
Maybe that's why
It's
I'm not
not.
wearing
It's
these
not something.
epaulets that you're wearing there.
Yes. So
Okay. Yeah.
basically, the blood is flowing from the heart, but now it can
Mm-hmm.
reach the various muscles of the heart. So there is lack.
Mm.
There's shortage of blood flow. Yes. So in
Okay.
this case, the heart is pumping. Mm.
So if it's a shortage of blood going through other parts of the body, does it mean that the body, the heart has to work
Mhm.
harder to pump? Oh, yeah. That's
Exactly. It
yeah.
has, remember with a heart attack,
Mm.
and I said it's good because we've got signs, you know, unlike where we have a cardiac arrest. So with a heart attack, we call it angina pectoris. That is a medical, it's a
Tim. Okay.
medical term. Now this one, the cardiac arrest is different from the angina. But as I said, the angina, it will give you a warning, a warning, and warning. And if we are not taking care of it, eventually we can have a cardiac
Mm.
arrest. With a cardiac arrest, now the heart is not pumping, it has stopped. So that is the difference between the two. But now, if we deal with the angina pectoris, we are able to prevent the cardiac arrest. So it is very important to know how it presents and what can be done to prevent this
Okay.
to
All right.
occur.
Now it makes sense. So what are the common symptoms that one might need to look out for? Because you're saying if that happens to you and you don't take note of it, eventually you'll have a cardiac arrest. So what are the symptoms that we need to be on the lookout for?
The main symptom is that sudden chest pain.
Okay.
That sudden chest pain on the left, it will happen mostly after activity. For example, it can happen after you have exercised. It can happen after you have lifted something heavy, after working at home, we are doing garden, all of a sudden you just have this pain. It also happen after, most of the time, after people have taken a shower or a bath. Remember, that is also an activity. Now, as I said, it will last for few seconds. It will happen, and then from there it goes away. Now,
Okay.
what also you will feel,
Right.
it will be that pain, it will go to your shoulder up to the tips of your fingers,
Mm-hmm.
right? It can also
Okay.
go to your neck, it can
Mm.
also go to your back. So when that happens, as a warning, we should know that something is happening, and therefore you need to seek medical help. So sudden chest pain after activity, it's very, very critical because it's not supposed to happen. You need to do your daily chores, exercise,
Okay. All right.
then from
So
there
for the
be
benefit of
okay.
us that are not well educated in this field, you spoke about heart attack. You spoke about
Mhm.
cardiac arrest, right? Can you go back there and really explain to us what is the difference there?
Yes, yes. Okay. So remember when I said with heart attack,
Yeah.
this I said the heart is pumping,
Hmm.
but then there's obstruction.
Obstruction. Okay.
There's obstruction. Yes, the arteries could be constricting, and the arteries, there could be
Mm.
clots, all right, that are preventing this blood flow. But with a cardiac arrest, now the heart is not pumping anymore.
Okay.
In this case, the heart stops. And most of the time, the difference is this one, it happens when a person is resting. It can happen, the person probably is just sitting on a chair, relaxing, and then it happens. Or the person
Mm.
is sleeping. That's how it happens. Now, that one, it's a
Is it painful
cardiac
though?
arrest.
Because how you explain it, if it happens and you're resting,
No. Remember, it won't be painful, and that's why I didn't put in
mm,
any pain
okay,
in my
all right.
sentence.
I know you can't choose.
Yes,
Mm,
there's no
I
pain.
know you can't choose your eventuality,
Hmm.
but yeah.
Yes, so the person, yeah, so this one
Mm,
doesn't even have
that's a risk, eh?
signs.
So then how do we reduce the risk?
All
Mm,
right. Remember, there are causes, right? Um, there are causes of angina pectoris, or there are causes of heart
mm,
attacks. For example, the smoking. Smoking is very bad, and unfortunately, tobacco will cause all those clots
okay.
and then eventually constrict the blood flow. Lack of exercises, blood pressure, diabetes, stress, obesity, also the waist circumference.
Mm,
It's very critical to measure our waist circumference. For example, for females, your waist circumference, the maximum should be up to 102, whereas with males, it should be up to 108, 108. Therefore, it's very critical for us to measure our waist circumferences, because if
mm,
it's
mm.
it's it's bigger than the normal,
So
we are at
do we
risk
have
of
any?
these heart attacks.
Mhm.
Mm. And also having high cholesterols. Mhm. High cholesterol. So it's very critical as people to know our numbers. And when I say knowing our numbers, at least once a year, go and check your blood pressure, your sugar levels, your cholesterols,
Okay.
which the normal should be at least less than 5. The waist circumference, I spoke about it,
Mm.
right? And also, um, exercises, right? With exercises, yes, I know we don't have time, but I guess if you want to make time, you will make time, just to walk 30 minutes thrice a week, which it will do the best to those cardiac muscles. Remember now here we are exercising those muscles where we want blood flow, because if we lack blood flow on the heart muscles, then we are in trouble.
Yeah. Thanks for those warnings there. If you just join us on the show from Telegram or also on Riverside, we're talking about heart attacks. Currently, we're just trying to see how we can identify them and what is the difference between a heart attack and a cardiac arrest. And as our esteemed guest has explained, a cardiac arrest happens when you're resting, and yeah, she says there's no pain in there. But then the heart attack is something else, and maybe this may also bring out other questions that you may have.
Yes, I see there's a
Okay,
question
sorry, I'm getting,
there's a
yeah.
question about the normal waist circumference.
Mm,
For females is 102
yeah.
and for males is 108. 108.
Yes.
Yes,
Thanks, Maggie,
102.
for that question.
Yes.
All right. So 102 for females and
102
one.
less. Yeah,
Okay.
102 and less. And meaning
Okay.
that these are the maximums. 108 for males.
Okay. All right. No, thank you so much. So let's move ahead then. I think Maggie's still typing a question there. Is it centimeters? 102 and 108. Are they centimeters or that's a
Yes,
question there?
yes.
Okay.
Yeah, it
All
is.
right. Thank you so much. All right. So we've now seen that we will have warning signs that we need to heed. But
Yes,
if we have
yes.
an impending heart attack, which warning signs do you have? Um, I know you spoke about chest pains. What other warning signs
Mm,
that we need
mm.
to be on the lookout for um, before we get a heart attack, or to know that we're
I'll,
almost
I'll,
getting a heart
I'll,
attack?
okay.
Mm,
I'll talk mostly about males.
mm-hmm.
Our males, their sexual activity will go down, because remember now there is no blood flow,
Okay.
right? So it's not about pleasure, it's about whether there is blood flow to various parts of the body,
Mm-hmm.
right? And also with females, we can also see with swelling of the extremities. When those legs are starting to get swollen, you need to ask yourself what is happening, because all that you need this blood to flow all over the body, not to some parts of the body,
Mm,
but all the parts of the body. And I will emphasize physical activity is the best. So I really encourage everybody. Yes, sometimes people will be saying you are exercising, but you are not losing weight. But they are forgetting that we are focusing on the heart muscles. Those muscles, they need activity, right? And as we grow older, the activity it just slows down. And therefore, as people, we need to take effort to make sure that we are doing something. And also with smoking, people that are smoking, they'll always defend themselves that I've been smoking for more than 20 years. You know, yes, they are smoking, but they forget that actually they are shortening their lifespan, their given lifespan. Because when that is going to happen,
Mm.
it will be too late to say, we told you to stop smoking. And I'm saying if we know our bodies, then we are able to correct. And I still say the good thing with a heart attacks, we are getting warnings and warnings and warnings. And one thing I need to highlight, if this episode happens to you, may you kindly go and seek help immediately. And most of the time, there's a machine that they use, electrocardiogram. It's in short is ECG. When you get there, you explain the episode of what happened. And at that time, after this
Mm.
episode of heart attack, most of the time you will feel
Mm.
very tired, as if you were doing something very heavy. Now, when you get there, most of the time the ECG will be normal, but you should know that you as a person, you need to take action. And what is that action? There's various things that I told you about: exercises, diet, reducing your blood pressure. And the
Mm.
other thing, critical thing, have an aspirin daily. They can prescribe that to you, or you can also prescribe that to yourself. And remember, after COVID, we have seen a lot of deaths, sudden deaths, and we are wondering, where does this come from? And clearly we don't know what is happening, but most of the people are now suffering heart attacks in their sleeps after activity, and they don't know why. But how can we prevent it? We can prevent it just taking your aspirin half daily or twice a week. It is fine. But when you are on a blood pressure medication, you can add also what we call, there's a tablet called Ecotrin. Equatrine is, it's a tablet. You can buy it over the counter. It is 81 milligrams.
Okay, Sister Kathy, we seem to be struggling with internet. So what I'm gonna do now, I'm gonna activate a low bandwidth. It might switch off our cameras, but don't worry, we're still with you there. Please bear with me. Okay, while we're trying to get Sister Kathy back online with us, if you have any questions or comments, please don't hesitate to ask the questions, and then we'll see when she comes back, and we'll be able to ask her, and then she can comment. Or if you have anything to relate about heart attacks, or somebody that you know about heart attacks, how they went through it, please share the story with us. That story could also help us, um, help us deal with what we can do. So we see a comment there. Okay, you can hear us. Can you hear us, Sister
Yes,
Katie?
I can.
Yes, we can hear you now. Thank you for joining back. So,
Yes. So I was still talking about the medical intervention, which involves the aspirin and the Equatrine tablet. And also, I normally I like observing people when they talk, especially face to
mm,
face. And probably this is something that you can learn also, as normal people or people that are not medically trained. There's a vein that you can observe. Hello, Neo.
yeah, yeah, we can hear you.
Y- Yes, there's an art, we call it it's a vein, a jugular vein.
Hmm.
I don't know whether you can all see me. This vein on the neck. When a person speaks, just try to observe that. Um, because you are able to see if the heart is beating extremely fast, than the normal, right? So, especially if a person is having an obstruction, blood clotting, you can actually observe the jugular vein. It will just be beating very fast, uncontrollably. And that person probably, you find that she or he doesn't feel any pain. But because you are observant, please just ask the person to consult, because that is a very, very critical a sign and symptom of a heart problem.
You also spoke about aspirin, taking aspirin, half an aspirin a day, right? Now, I've seen there's two types
Yes,
of aspirin. There's a blue one and the red one. Which one are you referring to, or are they similar?
it doesn't matter. Yeah, the blue or the red, it's still fine.
Okay,
They work the same.
okay, all right. No, thank you so much.
I
Anyone?
see there's a question.
Yes,
There's a question there
from Maggie.
regarding the vein that I should hear from Maggie.
Yes,
I don't know if you can and see me.
yeah, we can see you now.
Yes, on my neck,
Yeah,
left side, you
okay,
can see where I'm pointing.
yeah,
That is a jugular. That is a jugular
okay,
vein, right? And if I'm talking now, you can see it is
moving
actually,
up. Okay.
beating just very,
Mm.
up and down nicely. But if somebody has got a clot problem, this vein will just be like this, non-stop. And that particular person won't be having any pain,
Hmm,
nothing,
hmm.
no sign.
That's scary. So, what other treatments do we have for someone that is experiencing a heart attack? So, up to this far, we spoke about
It's just
yeah,
unfortunate. Yeah. So we spoke about lifestyle changing. We
yeah,
spoke about aspirin.
mm,
And unfortunately, basically those are the solutions that we have right now. Because now, if we talk something more than this, we are talking about the person who is in ICU. Let's say, for example, a person gets a heart attack at home. First thing, first, and actually almost all of us, we should know how to perform CPR.
mm,
CPR is first aid where we blow. We need we first check signs of life. If there's a pulse rate, yes, we'll realize there's a pulse rate, and after that, then we start blowing air twice in the mouth with the chin lifted up, and then from there we will start pumping
mm,
15 times. And in the meantime, somebody should be calling for help, because it will be
mm.
something that is strange, you won't know. But like I said, what the good thing
Okay.
about the heart attack,
So
there will
we
be a
must heed
warning.
those warning.
Because now if this person collapses, now we are going to what? To a cardiac arrest. Yes, yes.
All right.
So let's prevent going to the cardiac arrest by dealing
All right.
with
We do
the
have a question on
angina.
Telegram. Dr. Race Itesa has joined us as well. Please unmute yourself.
Thank you, Neo. Thank you, Sister Cathy. Brilliant job so far. We still continue listening to you. It's so nice listening to you explaining issues around heart attack and cardiac arrest. I don't have a question. Sister Cathy explaining so well. Maybe an add on what she's been saying so far, so that we all follow her in a way that we understand what she's trying to say. On treatment, as she said, aspirin is what we have, because other than that, you need to be in an intensive care unit. But for those who's been diagnosed with myocardial infarction or angina pectoris already, they know their doctor usually give them a tablet to put under the tongue. The tablet is called NGZ. Yes, yes, my sister. So that tablet, what it does, as Sister Cathy brilliantly explained, your vessels in the heart might be constricting. So it becomes small and doesn't allow the blood flow to come easily to your heart. And then that tablet that we'll be talking about now will now open. You try to vasodilate, to try to open your blood vessels so that the blood can come easily, flow easily in heart again. So that's one of the things I wanted to mention. Probably Sister Cathy forget because Neil is asking us so many questions at the same time. Yeah. Again, I wanted to add on Equatrine and half of aspirin. Yes, Sister Cathy is right. She is very right. Equatrine and half of aspirin will assist you in trying to make it. Those are blood thinner. We call them blood thinners. So they make your blood to flow easily, to not get heavy, so that it doesn't form a blood clot easily. So it becomes thin and it flow easily, just like water. It's not get thicker. Then just a caution on those who go by Ecotrine. Ecotrine actually is better than half of an aspirin, because half of an aspirin is 150 milligram. It's a bit too much. Ecotrine is 81, like Sister Cathy said. That's even much better, because if you've got an issue with a blood disease or blood disorder or bleeding, like you've got people who are bleeding easily in their nose, we call it epistaxis, or people who've got veins issues, dilated veins or DVT, veins that are raised, you can see them on the legs. Those people can bleed easily. So then aspirin becomes a problem here, because aspirin gonna actually make your bleeding issue worse. So when you drink aspirin, because you had a heart attack, then you bleed on the nose heavily, or you can even bleed in your stomach heavily. You can vomit blood, or you can pass blood through anus. So just a bit of a caution. Over the counter, good, but usually it's better to refer with your doctor and to mention that you've got maybe a bleeding disorder. Then the doctor might suggest something else. Sister Cathy, brilliant job. We continue listening to you up to the end. Please carry on.
Thank you, Dr. Itesa, for that comment. Can I just leave you like that, Dr. Itesa, without muting you? And you can jump in whenever it's necessary. You okay with that, Sister Cathy?
Yes, sure. I'll prefer that assistance. Thank you.
Thank you. So we still have another question from Khemi. This is Khemi. Please unmute yourself.
Good evening, Neo. Good evening, Sister Cathy. Yes, this is very informative, because I think we need all the information we can get to manage our heart's processes. Based on the information that she just said, I just want to know that for how long should a person wait once those signs are happening, the chest pains and maybe feeling dizzy or tired? So it should happen how many times before you can go and see the doctor? And the actual heart attack, when it happens, what happens? Do you fall? Do you collapse? Or exactly what is it? What is the physical action when you get that heart attack? Thank you.
Okay.
Over to you, Sister Cathy.
Yes. Now, especially with us at the preventative care, all right? We always advise that immediately it happens, you have to seek medical intervention. You can't wait another 2 days, 3 days. You have to go immediately. With some patients, they fall, some they don't fall. They just, they will bend and then from there they sit down, because you find that the minute you rest, then you will get relief, but obviously you won't be knowing what happened. So it is very critical immediately to seek medical intervention so that they can proceed with various tests to check what happened. And as I mentioned regarding the ECG, most of the time they will do that ECG immediately when you get into the casualty. And from a clinic point of view, and unfortunately, like in our area, I think we had about two angina pectoris, the heart attacks, and unfortunately, those people couldn't survive. And I'm talking from a, a clinic a point of view. So we can't say wait a day, wait 2 days. No, you can't do that. And remember, like I said, this can be an unstable angina. It gives you episode. You can have episode 1, episode 2, or have only episode 1. Then next time it doesn't happen anymore, then that's where you collapse and
Scary.
it's amen.
It is very scary. So Tlakadi also has typed the question there. She says there's also a Aspirin that is specifically written cardiovascular. Is that also better than normal Aspirin?
Well, I don't know which one would be better. And as a doctor was explaining, let's rather opt to something that won't be harsh to the lining of the stomach. Yeah, rather also ask the doctor. But for me, the blue and the red they're just the same.
Okay. I see Dr. Itesa,
Yeah.
you're unmuted there.
Yes,
Please, Dr. Itesa,
Sister Cathy is right.
before you jump in there, I apologize to Sis Khemi. Sis Khemi is a registered social worker. I just wanted to put it out there that she's also a professional that also can give help in issues like these ones. Over to you, Dr. Itesa.
Thank you, Neo. Thank you, Sister Cathy. Sister Cathy is right, Sister Fanny. Sister Cathy is right. The Aspirin is 150 milligram, a half one, because the full tablet, you get it with 300. You put it in water, you dissolve, and you drink. That makes your blood thin. And then it helps to flow the blood back to your heart, because that's what it needed. When you've got heart attack, your heart doesn't get enough blood and doesn't have enough oxygen. And the muscles feed themselves with that sugar and that's oxygen as well. So it doesn't get enough, and you start having that pain. That pain. You feel dizzy, you feel tired, you feel sweaty, you feel like someone comes, hold your heart, starting to compress it.
Yeah.
Your heart becomes tight.
Mm.
You will not ignore this pain. It will tell you that you never had it before, and this needs an urgent intervention.
So what is that?
And then
Is that a heart attack or a cardiac arrest?
Yes, it's the heart attack.
Heart attack, yes. Okay. All right.
And then, as Sister Cathy said, you don't have to wait. You look for medical assistance. If you've got something like a panic button, maybe you cannot talk, maybe you cannot move as much as you can, a panic button that is linked to maybe an app and now I'm not going to try to advertise anything here, but there are
Apple.
that they need to pay you before I can start advertising anything here.
Yeah,
We want them
that's
to
right.
come on board and start sponsoring this brilliant show.
Yes,
So there
thank
are
you.
apps that are linked with your cell phone number. You just press the switch on and off button, and then it's going to link to the heart attack to that app, and it's going to dial a call that will go to the ER or to any emergency service and comes to your address according to the GPS coordinate. That is brilliant. I find it very brilliant, especially for people who cannot even make a call, or people who are living alone, or the old ones who are living alone. So that can really help. Or if you've got someone living with you, you just tell them that you're not feeling okay, and they can call an emergency service. So those are a few things that we need to keep in mind. And again, the cardio care, someone in the audience asked a question. The Aspirin cardio care, it's 100 milligrams. Yes, thank you. So it's 100 milligrams. It's good. So remember now, we're coming from soluble aspirin. It's 300. Sister Cathy explains very well. She says you only get half of that, which is 150. Now, this other one, Aspirin cardio care, it's 100 milligrams. And you've got your Equatrine, which is 81. So the choice is clear. If you want to go, as Sister Cathy said, a lesser harsh way, you will probably go with 81 milligram with less side effect. Because then, if you've got a bleeding issue as a side effect, you won't really have that happening to you instead of going with 100 milligram or 150 or 300 milligram at once.
But basically, what I'm hearing from the two of you is we need to go and seek medical help. This self-medication would not help us at all.
True, very true.
Yeah. No, thank you. I see Tlagadi says, okay, understand. Yeah. Yes, please go ahead.
Yes,
Sister Cathy, you
yes,
can
I
go
was
ahead.
just saying earlier on I spoke about knowing your numbers. It's very, very critical because if you know your numbers, if you know your blood pressure, if you know your cholesterol levels, if your weight is okay, if something is not right, then you are able to detect a problem before it even comes. So at a clinical point, we always encourage let's prevent than treat. And that is the main thing why we've got primary health clinics there, or
Prevention is
doctors
better than
before we
cure.
get into
So,
hospitals.
okay, we do have another question or comment on Telegram. Hilda,
Correct.
you can unmute yourself.
Hi, Sister Cathy. I suffer from hyperactive thyroid, and at some point I was given Equatrine. Is it really necessary for me to take Equatrine with hyperactive thyroid? No, can you hear me?
Well,
Dr. Itesa,
can the
would you like to jump in on that
doctor?
one? Dr. Itesa, I see you're unmuted.
Or maybe I can say something. Hilda, thanks for the question, because I do not know what did the doctor see with the hyperactive thyroid, why he or she prescribed Equatrine, because the main function for the Equatrine is to thin your blood. So probably there is something that he has seen, and that is why he recommended or prescribed the Equatrine.
Is your question answered, Hilda?
Yeah, but at some point I actually stopped taking them because I really didn't see the need. I'm not sure if I was doing the right thing.
Hilda, I would encourage you to take it, especially as we have explained. Probably there was an indication for him to prescribe the Equatrine. Even probably if you don't take it daily, maybe once or twice a week, it will help thinning your blood. And I'm still going back to say, probably there's an indication that the doctor identified, and that's why he prescribed that. But also, you need to go back and ask the reason why Equatrine was prescribed, and is it okay if you stop it? Because probably he has seen something that me and you don't know.
Okay. And another reason I actually stopped is when I take them, I'll start nose bleeding. But I hear you, Sis Cathy, I'll have to go back to my doctor.
Oh, okay. Yeah. Now,
I also agree with that.
yes. Thank you, Hilda. You see that, yeah, you see now with her, she's taking it, and then probably the blood is now too thin for her to take it, and that is why she is now bleeding, because she's not supposed to bleed. So if you are experiencing nosebleeds, then definitely you will have to stop it and go
Right.
back and inform the
that
doctor
makes sense.
that this is happening.
Are you covered, Hilda? All right. Thank you so much. So, Sister Cathy, I see the time is creeping in there, but while we have a few minutes left, what are the long-term complications or effects that may result from a heart attack? All right. Before you answer that, I see Dr. Race is back. Can I allow you to maybe answer that question that was asked?
Eh,
Dr. Race, you can unmute yourself.
Yes.
Thank you very much, Neil. Thank you, Sister Cathy. What's the name of the person who asked the question about hyperactive thyroid? Hilda. Thank you very much, Hilda. May I ask you a few questions, if you may? Hilda?
Yes, you may ask.
Thank you. Do you know your height?
I'm not sure, but previously I was 1.72.
1.72. Yeah, you didn't grow taller. That's what I'm very sure. So meaning you still 1.72. Okay. If that's the case, 1.7. I'm trying to make calculations as we speak. And what is your current weight, Hilda, please?
60. My actual weight is 75, but with the hyperactive thyroid, yesterday when I weighed myself, I was on 60.
You are on 60. Okay. Let me try with 60. Yeah, with 60, you are brilliant. Yeah, you've got a healthy normal weight because your body mass index it's within 20, and the normal range starts from 18 to 24. Now, the reason I'm asking, I'm trying to find out why your doctor prescribed you Equatrine, because if you were obese, maybe he would be start worrying about you having a heart problem. You know why? Because when you've got the hyperactive thyroid, you also have some symptoms that involve your heart. Your heart beats rapidly, and the heartbeats are not really regular. They are sometimes irregular. Can you feel sometimes your heart beating?
It's as if it will come out of my t-shirt.
Yes, that's the problem. Because normally, to a normal individual, you cannot feel your heart, but it's beating, it's working. If you start feeling it, we call it palpitation, or you really think it's a problem with your heart. Then it's rapid, it's irregular, especially in your case, in hyperactive thyroid. So now your doctor was trying to prevent something very important, which is a heart attack, as Sister Cathy was explaining. So he knows that he's preventing that to happen. Sister Cathy said prevention is better than cure. Completely, I totally agree with that. So your doctor was trying to prevent your blood to clot, your blood to be heavy or thick. Now he gave you a blood thinner to prevent a heart attack.
Speaking of that, Doctor,
so now,
may I continue?
Can I finish my idea? Then you can tell me, please. Now, when you just said something very important again, when you took it, you started having a bleeding nose. Then that's a contraindication of you continuing taking the same Equatrine. So you need to stop it, because now it's causing you more bad than good. You need to go back to your doctor and he will suggest something else to try and prevent the heart attack that he was having in mind when he prescribed Equatrine.
But what scares me now is the nose bleeding. The blood comes with clots.
Coming with clots, it simply means that you bleeded and it didn't come out, then it came out later on. So blood clotted, because if you bleed now and it's come out now, it will mean that it's coming directly. If it takes long, then it's clot. Yeah, it just took long before you can actually see it. So it clotted. But if you're bleeding actively, it will come out like normal blood, red blood, liquid blood. It won't be clot. So my advice to you would be, you go back to your doctor. He knows you better than Sister Cathy. I don't know your previous history, your past history and all that. So he has your all history in the file. He's the best one to suggest what else you can take. But yeah, it's good that you stop it, because you had a side effect, as we mentioned earlier. Yeah, we had it. That's why it's not good to go buy all these things over the counter. So you had a side effect, then you have to stop it. But please kindly go back to your doctor.
All right, thanks.
You're welcome.
Well, thank you so much for that input, Dr. Itesa. Some of the things, I don't know, maybe because it's such a mission to go to a doctor. You're thinking about your medical aid, you're thinking about payments and all of these. Then you start doing things on your own at home, and over the counter. But honestly speaking, we do need you doctors, and we really appreciate for the hard work that you're putting in, the sacrifice. You're sacrificing time from your families. Even for this show, you would be sitting with your families, but you're here with us, and we do appreciate from the deepest roots of our hearts. And we want to thank you, everyone that has joined us with your comments on Riverside and also here on Telegram. Your questions really sparked information that we all needed to hear. You're not just going through what you're going through. Everyone is. We just didn't know, but you were there before us. Now you have set you've opened up doors for us to understand what we need to do. Maggie says there, thanks, Sister Cathy, very insightful. Yes, also echo that, Sister Cathy. But because of time, we will not go through other questions. In fact, we've run out of time. And usually this show, when it hits up, time just runs away from us. We just need 2 hours of the show, even more. But unfortunately, we can't do that. But thank you so much for joining us. Sister Cathy, we hope that we can have you over for a follow-up show. Maybe answer some of the questions that we never got through, and maybe information that you also had prepared for us and you wanted to share with us. So for closing remarks,
may I suggest?
Yes, please. Yes, Helda.
May I suggest the next topic, please? The thyroid. People are not aware of thyroid.
Yes.
When you discuss with people, they ask you, what is thyroid?
Yes.
You try to explain, they still don't understand.
Yeah.
And they say, they said, one lady said to me, you know why you get so sick every time? It's because you've got a medical aid.
I'm not laughing, but it's very sad.
You understand?
It's very
So
sad.
yeah, please.
Yeah.
Can we discuss the thyroid? Because even myself, I do have it, but I still don't know what is the cause. What causes it? Maybe in our next topic, let's tackle the thyroid, please.
We'll definitely consider that. That will be on the cards, definitely.
Thank
And
you.
we do have professionals that can help us with the information. We have Sister Cathy Seakamela that can help us. We have Dr. Rezi Tessa. We do have an abundance of professionals that can really, delve in this topic and give us some information. But thank you so much for joining us. We hope that you can join us for our next show. We always have these kind of shows on Mondays at 6:30, and whenever we have special topics, we'll post, and then we'll ask you that to please share with everyone else there. This is the platform that we can talk about these things and invite our doctors, professionals to come over to answer questions that we might have. Thank you for joining us on Riverside as well. Thank you for those that have also joined on YouTube as a live session there. And then we're going to have this show recorded and also put up on YouTube and also on podcasts that you can watch and listen at the later stage. And this is Nao Morapedi, the host of NMP Talk Show, and this is how we're signing out.